You may not be aware of the fact that November is National Epilepsy Month, and that takes on a lot of different characteristics for a lot of different people. And we're here to find out a little bit more about exactly what epilepsy is, how to get it treated, and for those around the person who has epilepsy, how to help them better understand it as well. We have Angela Ficca who is here, and Angela, you are the education program coordinator at Erlanger, right?
Yes, that's correct.
Very cool. A lot of people, in fact, most of us have heard the term epilepsy, but it has a lot of different forms, correct?
That's correct. Yes, epilepsy is a neurological disorder that results in recurring seizures. And that's, some people refer to it as an electrical storm in the brain. It's irregular brain activity that results in the seizures. And that's what epilepsy is.
It affects every patient differently. Like other diseases, it takes its own set of symptoms, if you will, and some patients report having mild seizures, and some you've seen the grand mal seizures where it's a tough thing to look at. How do you begin getting treatment for that at Erlanger?
So Erlanger, we have a couple of different avenues. We are fortunate to have what's called the Epilepsy Monitoring Unit at Erlanger. We have 4 beds in the Epilepsy Monitoring Unit where patients will come in and have a long-term EEG. So they will be in with us for about 3 to 5 days. They'll be monitored continuously over video monitoring as well as the EEG. It's the best and most reliable way to determine if someone has epilepsy.
Is the medical community as a whole making strides in the fight against epilepsy?
Absolutely. We have some of the best providers in our office who care deeply about their patients and work tirelessly to make sure that they receive the best treatment possible. We want our patients to live a full and seizure-free life if possible, and our providers are doing the best they can.
We have said during some of the other chats that we have had with various departments from Erlanger, it's a well-deserved reputation for not just treating the patient, you treat the patient's family, answering all of their questions. What's the most common question that someone who maybe is recently diagnosed with epilepsy has, or their family has?
So education is a big piece of that. Family members want to know what to do if someone has a seizure, especially a grand mal or a tonic-clonic seizure. So educating them. Patients often have questions about driving. That can be impacted if someone has a seizure. The law requires that they be seizure-free for 6 months before driving. So that's a question that people ask as well. You
mentioned a grand mal seizure just a moment ago, and then another type that I was unfamiliar with. What is that?
So absent seizures are seizures where there may be some blank staring, some zoning out, kind of a missing of a time period where they're not going to remember that. Tonic-clonic, which is probably what I said. Yeah, so that would be a grand mal seizure that you're referring to, where there's a stiffening of the body and then followed by shaking. What are the after effects for the patient following one of those grand mal seizures? Yeah, usually the patient is tired, very exhausted. Some people relate it to running a marathon. That exhaustion can last for days. For some people, a week, longer. Oftentimes there's a period of just coming back to awareness and then followed by that exhaustion. What's the emotional or psychological impact the patient has following a seizure like that? So a lot of times people who are diagnosed with epilepsy also face some mental health issues, some depression, anxiety, depending on, they aren't sure where they're going to have their next seizure. So it could be in public, it could be in school, and so there is that anxiety that's attached to it as well. And the patients do know for a certain amount of time leading up to the seizure itself that it's on the way. Not necessarily. Some people have what's called an aura, where they do, it may be a certain smell, a metallic taste in their mouth, where they can sort of feel the seizure coming on, but not everyone. Many people don't have auras, and their seizure just occurs. And again, if you've ever been around that situation, you know how terrifying it is for the patient. It's terrifying for the family, and if you're in a public environment, those around you sort of freak out as well. Don't. How do we find out more information about the great work you're doing at Erlanger when it comes to epilepsy? So you can call us over at Erlanger. I'm the epilepsy program coordinator, like we discussed.
Right.
I'm here to help provide and kind of answer some of those questions for families, for patients as they're trying to navigate their life with epilepsy.
Sure, and it is navigable. There's no question about that.
Absolutely.
All
yeah.
right. Very nice to have you here on the
Thank you
broadcast.
so much.
We appreciate you coming
Thanks.
down. Doors always open. If you want to find out more information, again, check them out online. It's erlanger.org, erlanger.org.